Hi everyone, welcome back to my YouTube channel, and today we are going to talk about triangles of neck. So let's start our topic with introduction. Neck is divided into several triangular regions by muscles and fascia, which serve as an anatomical landmark. These triangles are clinically important because they guide surgical approaches, they help locate blood vessels, lymph nodes, and nerves, and they also provide easy access to cervical structures. The main muscle dividing the neck is the sternocleidomastoid muscle, which create an anterior triangle and posterior triangle. It is mainly divided into anterior triangle that lies in front of sternocleidomastoid muscle and posterior triangle that lies behind the sternocleidomastoid muscle. Anterior triangle of neck. It is bounded anteriorly by midline of neck, posteriorly by anterior border of sternocleidomastoid muscle, superiorly by lower border of mandible, and its roof is by investing layer of deep cervical fascia, and its floor is by pharynx, larynx, and thyroid gland that is covered by fascia. Subdivision of anterior triangle. The anterior triangle is divided into four smaller triangles by digastric muscle and omohyoid muscles. They include submental triangle, submandibular triangle, that is also called as digastric triangle, carotid triangle, and muscular triangle. First is submental triangle. It is bounded by both anterior bellies of digastric muscles and body of hyoid bone. Its contents include submental lymph nodes, small veins that form anterior jugular vein. Second is submandibular triangle, that is also called as digastric triangle. It is bounded by mandible superiorly and by both bellies of digastric muscles. Its contents include submandibular gland and facial artery and vein, lymph nodes, and hypoglossal nerve. Third triangle is carotid triangle. It is bounded by sternocleidomastoid posteriorly and superiorly by belly of homohyoid and posterior belly of digastric muscle. Its contents include carotid sheath that includes common carotid artery, internal jugular vein, and vagus nerve, and it also includes hypoglossal nerve and cervical lymph nodes. Fourth subdivision of anterior triangle of neck is muscular triangle. It is bounded by midline of the neck and superior belly of omohyoid and sternocleidomastoid muscle. Its contents include infrahyoid muscle, thyroid gland, larynx, and trachea. Now let's talk about posterior triangle of neck. Posterior triangle of neck is bounded anteriorly by posterior border of sternocleidomastoid muscle, and it is bounded posteriorly by anterior border of trapezius muscle, inferiorly by middle third of clavicle. Its roof is by investing layer of deep cervical fascia, and its floor is by prevertebral fascia that covers splenius capitis, levator scapulae, and scalenus muscle. Subdivision of posterior triangle. Inferior belly omohyoid muscle divide this triangle into occipital triangle, that is upper part of this triangle, and subclavian or supraclavicular triangle, that is lower part of this triangle. Its contents include brachial plexus trunk, cervical plexus, and spinal accessory nerve. It also includes subclavian artery and external jugular vein, and also lymph nodes. Clinical significance of triangles of neck. First is surgical landmark, as carotid triangle marks the landmark for carotid artery access during surgery and catheterization. Second is submandibular triangle, that is common site for lymph node biopsy and gland surgery. Second significance is lymphatic examination, as triangles are used to divide lymph nodes into levels for cancer staging. Third significance is infection spread, as triangles provide pathways for infection or abscess drainage. Fourth significance is venous access, as subclavian or jugular vein puncture is guided by these anatomical landmarks. Sixth significance is nerve location, as accessory nerve and cervical plexus nerve can be identified easily in posterior triangle. Conclusion of this lecture video. Neck triangles serve as a key anatomical region that simplify the understanding of neck structures and guide clinical procedures. Their boundaries and content are vital for head and neck surgery, oncology, and radiology. And this was all about triangles of neck. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.